Hello, hello, good afternoon. Welcome. Such bright, shining faces. Boy, if you guys put them to sleep, you get double demerits. 'Cause, uh, so nice to see everyone. Thanks for coming. I always want to thank you for the support of this and everything we're doing out here. It's really most meaningful to have your support of these resident physicians in their training. I think education is always a two-way street, isn't it? And y'all are teaching us stuff all the time. And I hope these are helpful to you and the other opportunities that we have to share what we know in a way that'll help you. So, welcome. I've been informed since the last meeting that there are more people that watch it from home than I realized. You know, back during the first wave of COVID, of course, there was a time that we were only doing it by video, by TV piped into the apartments. But so I haven't been able, and especially since not that many call in, and we have these meetings, and the whole question and answer goes through, and we don't get any call-ins. I've just been guilty of thinking not many, or maybe no one's watching it from home, but I've been corrected on that. So I want to give the number for those of you who might be watching this from your apartment. If you have questions, you can call in anytime. One of the doctors will answer and write down your question, and it'll be part of the question and answer. So the phone number actually is the same phone number. You could call one of them after hours if you're a patient of ours and discuss a medical issue you were having. So the number is 479 area code 200-9259. 200-9259. So people still coming in. Thank you. You're not late. Nothing important has happened. Nothing important happens until I hand this off. So as you know, those of you who've been here, most of you have, each 4-week block, we have 2 resident physicians. And a reminder, they're in their first 3 years after getting their medical degree. So Dr. Campos, Rebecca Campos, is a first-year internal medicine resident with us. She went to undergraduate college, got her undergraduate education at Northeastern State University in Oklahoma, and graduated from ARCOM, Arkansas College of Osteopathic Medicine in Fort Smith, which is putting out some pretty good graduates, and she's at the top of that list as far as I'm concerned. So Rebecca Campos is with us, and she's doing just a great job. And Robert Mann, you may recognize his face because this is his second tour of duty out here. Robert is in his second year of training, right? Second year, you seem like third year, but he's the upperclassman here. We usually have an intern the first year and an upperclassman, either a second or third year paired together. It's the way it usually goes. Dr. Mann had a whole different career and life before medical school. He was a college football coach and trainer. So listen, exercise is right down his alley. He was all about that. So he's going to have all of you pumping iron and doing skin fold measurements and what they do know already about exercise too is they know that the gift and the blessing we have of Jennifer Neal being here. Oh my goodness. Now once she knows you, you can't walk around her. She's going to ask you what you're doing, right? Confirm that you're doing all those things, those activities that are good for your health. Well, you know, putting it in context, we all know one truth about aging, don't we? That we have to be active. I think that's something universally agreed on. the adage, if you don't use it, you lose it, is profoundly true. And that's true with physical activity, things you want to stay able to do, continue to be able to do physically. But it's true mentally. If you want to be mentally sharp, you need to be mentally active. It's true in just about every aspect of life. So today we're talking about especially the physical aspects and benefits of activity and physical activity and exercise. So with that, who's going first? Dr. Mann is going to take it off. So we'll get that.
Yep. Hi. So, in 2002, I was a strength and conditioning coach at Arkansas when Houston Nutt was here, mostly with the football team for 3 years, a little baseball and basketball too. And then I had a fitness business after that, and did that for 10 years before I went to medical school. Sometimes, we like to have an exotic topic or talk about something maybe you haven't heard of, but it seems to me sometimes we just need to talk about the foundation of health more, and to remind you that there's only a few sort of broad categories of things that are really proven to make a difference in your health. And do y'all just off the top of your head know kind of the broad categories of things you need in your daily life to increase not just your longevity, but your quality of life? What are those? Sleep, exercise, diet, socializing. Yeah, you got it. Y'all are familiar with the blue zones of people who live the longest in the world. We'll talk about that in a second, but those are the common things amongst people who live very far apart from each other in the world. And I say that too because I was telling Rebecca that back when I was a powerlifter and strength coach, I really enjoyed buying supplements. I always wanted the next new supplement to make me stronger, right? But there were two people at the supplement store. People like me, spending a lot of money. Who else was at the supplement store? People who are in their later years looking for the new pill that was on Dr. Oz or in the magazine or something that has magical properties, right? We all spend a lot of money at the supplement store. And I just want to remind y'all that the basics are the basics because they're the only things that are proven. And just never forget that, because you're always going to hear about the latest and greatest pill, but the things you just mentioned are really what improve your quality of life and give you the best chance at the longest life. So, why is this important? Now, this may not be apparent to some of y'all. If y'all go to exercise every day, you may think everybody exercises at your age. But once you hit age 75, only 1 out of 3 men and 1 out of 2 women in this country have any physical activity. I think I worded that wrong up there, but most people are sedentary. My grandparents were both very sedentary over 75, but nobody saw them because they stayed in their house, right? And, a lot of times, y'all may have said this yourselves, we hear it a lot in the clinic, well, I'm just old, right? So is your loss of strength and endurance and energy 100% because you're getting older, or is there something that you can do about it, right? And so they were making the point, those are both the top 2 bullet points from the CDC page, that just the choice to not have physical activity, the choice to be sedentary contributes to the loss of muscle mass, contributes to the loss of cardiovascular function, contributes to a decrease in your brain health, okay? And then based on twin studies, just another thing, because it's always easy to say, I'm just this age, I can't do it. Young people will come up with reasons why we can't exercise. I say I work 70 hours a week, therefore I can't exercise. I've been saying that a lot for the last year and a half, right? That's an excuse, isn't it? But based on twin studies, they show that your longevity is only about 1/3 genetically caused. Everything else is a modifiable factor. Smoking, exercise, eating, sleeping habits, all of those. And then we were talking about the blue zone populations that may be the longest living populations on Earth. And I say activity in big words there because a lot of the articles you read, that you may see that they differentiate between physical activity just as part of your daily life versus exercise. Now, all of those populations, they just live a life that is active, don't they? Many of them wouldn't know what a treadmill is, right? They just walk as part of their daily life. I think they studied the men in Sardinia off the coast of Italy. They just herd their sheep 5 miles a day. That's just what they do. They don't consider it exercise, but they are physically active. To their body, it's daily exercise. So just any general physical activity is far better than sitting, in front of the TV, as most Americans do. And I say that bullet point about maintaining a habit. When I was a trainer, I had people that just worked out at 5 a.m. every day, right? That's just what they did. They got up, they came and worked out, they didn't think about it. It was not a decision every morning. It's just what they did. So if you or someone you know is making a decision each day whether or not to go exercise, a lot of times that decision is going to be, I don't feel like it today, right? You take away that decision fatigue when you just say, this is what I do at 5 or 6 or whatever time in the morning. I also say the mornings because when I was a trainer, you saw consistently the morning people were more consistent in their workouts than the people who try to come after work. Just a lot of stuff comes up at the end of the day for everybody. It's easier to not feel like working out at the end of the day. So I always sort of notice that in the people I train. The types of exercise I wanted to bring up because y'all may have a form of which exercise class you go to. Tai Chi, water aerobics, resistance training, and that is the end result and the choice that you're making. The fitness qualities that you are training are really broken down in this way when you look at studies. So you have resistance training. You increase the load on your muscles more than they are used to with walking or your regular daily activities. And then you have aerobic training where the primary goal of that is to get your heart rate up and keep it up for an extended period of time, right? So that's a little bit different than the actual resistance training on your muscles to increase strength. Flexibility, mobility, this can happen to all your joints. You may go to reach up in a closet and you haven't done that in a while and your shoulder feels really tight. Some people pull a muscle, tear a rotator cuff when those muscles are too tight. So just physically being able to get full range of motion in your joints is very important. You can't bend over and pick something up. If some of y'all have done physical therapy, one of the things they do is try to make sure that you have equal strength on both sides of a joint, but also appropriate mobility. Sometimes in our notes that we type, if you come in with a joint pain, we'll say, decrease range of motion in external rotation of the hip, because those things can cause other problems. It can cause, if you have hip immobility, it can cause lower back pain, for example. And those are the kinds of things that a physical therapist is trying to work on. Balance is a big deal as you get older. A lot of people have told me this month in clinic that they never thought they would be wondering why they were answering a question of how many times they've fallen this year. 20 years ago, they wouldn't have thought about that, and now they think about that a lot. So balance, you could also say / coordination. That's important. And then also added something about sort of the mind-body connection. So you've probably heard about this more and more in the past few years, but it's not voodoo. If I were to have y'all close your eyes and take some long, slow breaths while checking your pulse, you would see your pulse drop, right? All that is you deciding to close your eyes and breathe, and that is an obvious physiological response to something that you are doing mentally. So talking to Jennifer Neal, she talks to y'all about those things sometimes, whether it be Tai Chi or in yoga. Those do make actual physiological changes to the way your body is functioning when you are calming your mind and focusing on your breath, for example, okay? But this is how the fitness qualities are separated when you read papers. But when you go to do an exercise class, you will see these combined in the class. Water aerobics has both resistance to all your muscles, but you're also moving constantly. You keep your heart rate up for an extended period of time, so you're getting a great aerobic benefit there too. For example, yoga, you're often taking your joints through a large range of motion for flexibility and mobility while thinking about your breathing, right? And so that's the end result, is that these things are all combined in the classes. So, cardiovascular health. We're just talking about aerobic exercise. So again, you can check that box. You want this on a daily basis. If your heart rate is up more than usual for an extended period of time, we can call that aerobic exercise. Okay? You may notice, without checking your pulse, if you're breathing a little bit faster than usual and you can notice that, then that would qualify. And because that gives you a certain changes in your body when you're doing that form of exercise. And when we say exercise, we're also saying we're saying we're putting a stress on your body, right? That's what exercise is. This is a stress on your body for a short period of time. The improvements often come as you recover from exercise. So when we say you have to exercise, we say you need to stress your body for a temporary period of time daily, and then your body adapts to that, and that's where you get the health benefits, okay? So the things that I'm talking about that qualified, that you know it's exercise, are indications of some increased work on your body, increased heart rate. Your heart's got to pump more blood to get more oxygen to the tissues. Breathing faster, so you can inhale more oxygen to get more oxygen into your blood to get to those working tissues. So you have to stress yourself slightly every day. And I say that because when I used to train people, they would want to come undo 20 years of sedentary lifestyle and 50 pounds of weight gain in 1 month, right? I want to lose 50 pounds this month. I'm like, well, that's not going to happen. So just a little bit every day. It's a moderate at the most intensity is all you ever need. You never have to go hard. And really, if you do go hard, you will likely injure yourself and then be in front of the TV, living a sedentary lifestyle. So just a little bit every day is all we're talking about. But again, regularly, just make it a part of your daily life if you're not, or try to encourage your friends to do so. So have y'all ever thought about how blood pressure decreases? I know that y'all know that this helps your blood pressure, but do y'all know how that works? It's okay, because when your blood's moving fast through your body, the lining of your blood vessels actually releases nitric oxide, and that dilates your blood vessels. And I put this on here because a lot of times in clinic, when we talk about blood pressure, some people say, we'll tell them, well, your blood pressure's a little high today. What do they say? I feel fine. Is that really a problem? Do y'all know anybody who said that? I don't feel bad, so I don't think this is a problem. So why is high blood pressure a problem? Because, the doctor says it all the time, but, it's helpful to know why that's a problem rather than just Dr. Wright saying it's a problem, right? So one of the primary problems on your heart, the pump, is that it has to push harder, right? It has increased pressure on it. All that blood pressure makes the heart squeeze against a higher blood pressure. And so the heart tries to adapt with that to make the muscle stronger, but when it tries to make the muscle bigger and stronger, it often doesn't work very well at that point if it really is having to overcome high blood pressure all the time. But blood pressure is a big one because you don't feel it usually unless it's extremely high. You really don't feel high blood pressure. So that's one that you need to check it, and you need to stay on top of it to keep your heart health and also to keep your brain health, which we'll talk about in a second. Exercise actually can increase your cardiac output by your heart rate goes down, but the amount of blood that it can pump can go up. Okay, so your heart is a adaptive organ just like the rest of your body, and you can squeeze out more blood if you challenge it in that way every day. Other changes your body makes to exercise, aerobic exercise, you actually have increased capillary density in your muscles. So if your muscles are doing more work, they need more energy, they need more oxygen, and your body actually forms new capillaries in those muscles so it can be better fueled, okay? And it does this at any age. And you increase muscle fibers that take oxygen out of the blood. Those are kind of your endurance muscle fibers. These are all from studies in older people, okay? These are not from people that are, in their 20s. You improve your cholesterol. Your muscles suck blood sugar out of the bloodstream. When they're working, they need fuel. That's one way you can lower your blood sugar that does not depend on insulin. Your body doesn't secrete insulin. Your muscles, when they start working, pull sugar out of the blood through transporters that do not rely on insulin. You reduce your inflammation throughout your body. I know y'all have probably heard about that a lot. Inflammation can contribute. It really has a broad negative consequence on your cardiovascular health if you always have inflammation. And I want to mention your antioxidant capacity goes up. So, a lot of y'all take vitamin E or vitamin C or N-acetylcysteine, right? You probably have seen antioxidants all over the store, and I suspect have bought some yourself. Exercise can increase your own antioxidants. You have these in your body. Exercise is an oxidative stress. Okay, when you work out aerobically, your body has to do the very thing that you're buying supplements for to improve your antioxidant status. Exercise does that, and it stays up. You increase your capacity to deal with oxidative stress when you give it an oxidative stress every day. And that's important because last line, part of aging is that your DNA itself ages, and that's from oxidative stress. Okay, so exercise improves your ability to deal with oxidative stress. Brain health is cardiovascular health, right? Your brain has blood vessels. It only is as good as the pipes that are going to the brain, right? So, I think used to people may have thought about those separately, but your brain health is only as good as your cardiovascular health. So talking about blood pressure, I got this from someone I saw. Blood pressure was high in this person. They didn't feel bad. So he asked, he didn't really want to take any more medicine, who wants to, but it was fairly high. He says, well, how long do you want me to live? I'm not trying to live forever. But I made him the point that, it wasn't even the potentially dying that I was worried about for him because he's a very active person. I was worried about something happening that lowered the quality of his life, right? Sometimes we think about being alive or not, but y'all know and may have experienced that if you have something like a stroke, it grossly reduces your quality of life. And that's really maybe the worst thing, right? And so that is more motivating to okay, I'm going to get on top of this blood pressure. And that person that I'm talking about felt that way. Okay, yeah, that's true. I don't want to have a reduced quality of life. That's scarier. And so then we're getting on top of the blood pressure. So you see here that really this is almost a repeat of the cardiovascular health because it's the same thing. When you talk about stroke risk, you can either have a stroke because you don't get enough blood to your brain or you have a brain bleed from too high a blood pressure. Blood pressure is the number one risk factor for a stroke, okay? Most strokes are ischemic. That means you didn't get enough blood flow to your brain from some cause. You could have a clot, you could have a thrombus, which is where clots can break off from. And there's a couple of other causes, but look, the subsections are just, you can reduce your stroke risk. Look, just a 10-point reduction in your systolic blood pressure may reduce your stroke risk 40%. I mean, that's pretty large. If you have high blood pressure and you get on top of it, you're going to reduce your risk for stroke, and avoiding a stroke will increase your quality of life, right? I put a lot of medical words in here, but if you've known somebody to have a stroke, if you've had a stroke and you go to the hospital in time, we'll give you TPA. TPA breaks down clots, but you can't do it outside a certain window. But your body also makes that, and exercise can increase that. So how exercise reduces your stroke risk, that is another mechanism. We've already talked about improving your cholesterol. But next one down, fibrinogen and platelet activity. Are y'all familiar with platelets? Plavix, aspirin? How do those work? So, yeah, we use the word blood thinner a lot. They work differently. So I bring up aspirin and Plavix because they are anti-platelet medications. They keep platelets from sticking together. A blood clot is a bunch of platelets that stick together with a bunch of fibrin strands around them. Okay, I just want y'all to think about those things. So exercise can reduce fibrinogen and platelet activity. So that's one of the mechanisms that may reduce your stroke risk. And then again, we're reducing inflammation. Inflammation is probably a critical part of forming plaque. Outside of cholesterol is that you need to have this chronic low-level inflammation to put down plaque in your arteries. Okay, so exercise can reduce that. Obesity, big risk factor for all the things we talk about in the clinic, all the problems, and blood sugar. But I put those up there for another reason. Some of those things are actual medicines that we give. We give statins for cholesterol. We give TPA if you have a stroke. We give you Plavix or aspirin to reduce your stroke risk after having a stroke. But here I'm talking about exercise. So again, exercise is medicine. I'm showing the same mechanism happening in your body from exercise that you get to likely a higher degree from a medicine. And then sedentary lifestyle, just very much the opposite. You're going to increase your stroke risk sitting in front of the TV. And then if you have had a stroke, physical training can give you more function back. And then I was quick with this slide because when you talk about the immune system, it is a very complex topic even for medical students and doctors. But I did want you to think about, if you hadn't in a while, that just like your heart ages, your skin ages, your bone age, the cells of your immune system get older. But they do show in studies when they do these complex lab tests that immune function is better in older adults who have had many years of exercise than those who have been sedentary. And as you get older, an acute illness is a bigger deal, right? It's a bigger deal than it was when you were 30 because your immune system may not be able to fight it off like it used to. So physical activity can maintain the function of your immune system versus if you're sedentary, it will age faster. Okay, your whole body ages faster if you don't stress it every day. And then one of our other majors we were talking about in a healthy life is that here especially you can just have your social engagement right with your exercise, right? Those are two critical factors in your, not just your longevity, but your quality of life. But one thing that when I was doing group fitness classes, a lot of those people chose group classes over personal training because somebody could call them, say, hey, get your butt up off the bed and come work out this morning. I know you don't feel like it, right? It's helpful to have a partner because none of us feel like exercising every day at any age. I haven't exercised in a while, matter of fact, because I don't have a workout partner. So having a friend to pick you up or you pick them up when you're not really feeling like it is a big deal. Then you go talk. It's very stimulating to your brain just to have conversations with people. You get new ideas. It really, I mean, if you were to see your brain under a functional MRI, it's working. Just having a conversation with someone. That's all that energy you feel is because your brain is working, just having a conversation. And kind of the point I'm making here is that social activities improves all the things we've just talked about independently. But the point I'm making here is that we're talking about physical activity and socializing is both increasing all the same health factors. So now there's a bit of a synergy when you can do both at the same time, right? And so I felt like this comes up a lot when we go over to the nursing home, when they go to the nursing home for the first time. Most common statement is, I feel like I've lost my independence, right? No longer can cook for myself, clean for myself, do my own medications. And so I think, if you or someone you know is having difficulty saying, I just don't really want to go exercise, I don't feel like exercising, Oftentimes when people would come work out with me, it wasn't because they wanted to be healthy, a positive thought. It was getting away from a negative thought. So when a 40-year-old mom, I would get a phone call like, oh, I just want to exercise and be healthy now. I was like, 20 years, all of a sudden you want to start exercising? Tell me the truth. They went to the beach with their friends. They took pictures. They were the worst looking one in the picture in their opinion. There was a lot of tears. They called me, right? Getting away from something negative is often the most motivating thing that we have. And so it seems harsh, but you may notice in your own life that thinking about getting away from the scariest thing gets you doing exercise and other things that you may not feel like each moment, right? And I'm just real fundamental. When we're talking about cardiovascular, we're talking about a pump. It's a pump. It's a blood pump. That's all this is. It squeezes blood. And then there's pipes. If either one of those are not healthy, then none of your tissues are healthy. So cardiovascular health is critical to your brain health and the health of every other organ, okay? Because your muscles need oxygen and they need nutrients to work. And you need your muscles to cook for yourself and clean for yourself and, do anything that you enjoy doing, right? And so these things all go together and they're just, couldn't be more fundamentally important. And again, they show in DNA studies that, that you've probably heard people talk about this, the caps on the end of your DNA, they always, the analogy is like the plastic tips on a shoelace. They show that those shorten faster with a sedentary lifestyle. Your very DNA aging faster because you choose to sit down each day instead of doing whatever it takes to get moving. And you can always move, even if, as you get older, you can always have a new disability, but there's so many forms of exercise and so many people to help with it. There is always some kind of way to move more than just sitting in front of the TV. There really is. And so it's just, like I say, I prefer to think of it as one choice. Do I exercise or not exercise? You make one choice and then you do it every day, rather than waking up saying, am I going to go exercise today? No one's consistent when they make a daily choice. They just say, I do water aerobics 3 times a week, and if you ask me to do something during that time, I'm doing water aerobics. That's what I do, right? There's no decision there. That's just what you do. And so, bottom bullet point, the downward spiral of aging and sedentary lifestyle. If you sit, you age faster, right? Your muscles shrink faster. You have no stressor on your body, so your body has no stimulus to stay healthy and strong. So if you sit, you age faster. The more you age, do you feel like exercising the more you age? No. So now I want to sit more, which makes me age faster, downward spiral, right? I say it all the time. And then this is Dr. Campos.
Hello, everyone. Okay. Let's see. So this is a common complaint I hear in clinic a lot. Like, I'm not sleeping. I don't stay asleep. I can't fall asleep. So one of the things I try to stress is as we get older, our sleep patterns change. We wake up more. We kind of shift our circadian rhythms a lot. And I kind of put some of this on this slide. So we've heard of melatonin that we take, the little gummy or the little tablet or whatever. It's all natural. It's great. Your body makes melatonin. And as you get older, your melatonin decreases naturally. And so that messes up your circadian rhythm. Like I said, you kind of get that decreased total sleep time, the early morning awakenings, and your sleep is fragmented, right? You don't sleep 8 hours all at once. That would be great. But that doesn't happen so much. When we don't sleep, you have an increased risk of developing depressive symptoms, just feeling kind of down, you're tired, you don't want to get out, you don't want to do things. It's associated, insomnia, not sleeping and all that, associated with falls, mood disorders, anxiety, and cognitive impairments. So, of course, we're going to talk about how exercise affects that. When you exercise, you have anxiolytic effects, which means it decreases your anxiety. What's one of the things we lay down at night, we put our head on the pillow, and we think of everything we did wrong in the day. We think of every mistake we've made in our life ever. And then we can't go to sleep because our mind is racing. So exercise actually decreases that pre-sleep anxiety, specifically aerobic exercise. And the exercise can also help regulate that circadian rhythm and get you back into balance with that. And the study I read said that it was equal to bright light. So, we depend on the light to regulate our sleep cycle. Exercise is actually equally effective to that. It affects the stages of sleep. So stage 1 is your lightest sleep. It's kind of where you have those jerking movements. You feel like you're falling off a cliff and all of a sudden you jerk yourself, wake up. Exercise decreases time spent in that sleep. And then it also increases time in stage 2, which is a little bit more of your deeper sleep. And then less awakenings. The last bullet point, exercise depletes central glycogen stores, which is just kind of your energy. And when it does that, it leads to a release of adenosine, which will help you sleep better. Certainly, just kind of some overall great effects. Kind of wears you out, you go out, it helps you when you go exercise, wakes you up a little bit during the day, but then you go home and you can just kind of ease into that sleep without all that anxiety and laying there thinking about everything. This kind of goes along with that. So this big, long word, brain-derived neurotrophic factor. The main thing about this is it has an important role for learning and memory, and then it also affects the serotonin in your brain. So serotonin's that happy enzyme in our brain. We all want that little boost of serotonin. The higher levels of that BDNF actually help with depression because it increases your serotonin, and then it decreases your risk of Alzheimer's or dementia because it plays such a role in the memory and the learning. So this one study I read, this was one in elderly adults. I believe they were all over the age of 70. It compared people exercising just 15 minutes a day on a treadmill. That could even just be walking outside for 15 minutes to those that did not exercise. The exercise group not only had an increase in the level of this, they had a higher increase than those that did not exercise. So the exercise group had 35% increase, and the group that didn't had 16. And I really thought the last bullet point was interesting. As little as 6 minutes of physical activity a day can improve your mood. So just getting out, walking a little bit, get out in the sun, especially today. It's lovely outside. Certainly, I think more than 6 minutes is warranted, but if that's all you can do, that's something. Let's see. So this one, I am admittedly a little bit older, or a little bit younger than Dr. Mann here. Probably a little bit older in my joints and my bones. So this one for me is really important. I had both of my hips replaced before I was 21. So joints-wise, I'm probably all with you. This is something that I really endorse and think works a lot. I exercise every single day, whether that's walking outside. I like biking, which is great in Northwest Arkansas. And if I don't do that, my pain is like sky high. And I didn't for a long time. And my pain was just through the roof. I couldn't tolerate it. And it was hard at first to get out there and exercise. But once I got going and once I did it regularly, man, felt great. So this is kind of some of the studies talking about that. So chronic pain results in hyperalgesia, which is the increased perception of pain. So, even though you've got this chronic low-level pain, you start thinking, you kind of ruminate on it almost. And you're like, oh, this is so terrible. I can't do anything. I can't possibly walk. Like, I've had both hips replaced. I can't get out in there and walk like Dr. Mann gets out and exercises. But you can. Once you start moving, it's really going to release all of these things in your body that help. So that second bullet point was another study I read. Said that exercising could be as effective as NSAIDs. So those of us that like ibuprofen, Advil, all those things, exercising is actually as potent as those medicines we take and has less side effects and, as we've talked about, much more benefit in mood and heart disease and all those. Kind of like Dr. Mann talked about as well, the systemic inflammation. So I read some very over my head studies about this too. But basically, exercise mitigates cellular inflammation, which when we have chronic pain or, we have this low level state of inflammation, which is why a lot of those NSAIDs help us, because that's a non-steroidal anti-inflammatory. Well, when we exercise, it gives us those anti-inflammatory properties. So that helps. And then, so your total amount of exercise, like over the week, is more important than the number of days per week in one of the studies I read. Let's see. Fall prevention, like Dr. Mann mentioned, a lot of people worried about falls, we're scared of falls, what happens if I fall? So this is kind of the first little part is about some CDC guidelines. Around 3 million older adults are treated in the ER for a fall injury every year. 1 out of 5 of those results in 1 out of 5 falls results in an injury. And every year, at least 300,000 older adults are hospitalized for hip fractures. And then one I didn't put on there was 95% of those hip fractures are from a fall. So walking for at least 4 hours per week was associated with a 41% lower risk of a hip fracture in postmenopausal women for that study, which, that's a detrimental thing to fall and have a hip fracture. Then you're going to get your hip replaced like me, and we're going to go have fun together walking. So that's a huge benefit to just getting out and walking. There was another randomized control trial. So it talked about the increase in flexibility, body balance, muscle power, and walking ability in older adults. They kind of took people that were not exercising, and then obviously ones that were, and put them in an exercise program. And they did all these different studies to look at these different aspects, but a couple of the things were a timed up and go. So how long does it take us to get up out of our chair and walk? And then the walking ability kind of looked at your walk stride. So something somebody was telling me today was they used to take slow shuffling steps. We walk like this. When we walk, we need to take long steps. And these studies kind of showed about how those longer steps result in a decreased risk of falls. And same with the timed up and go. We feel more steady. We don't feel so shaky and like, oh my gosh, I'm going to go down. And then I know one thing you guys have here, the Tai Chi. So 3 weeks over 6 months decreases the number of falls, risk of falling, and fear of falling. Again, we're scared we're going to fall. We don't want to get up. We don't want to exercise because we're worried what will happen. And that's it.
Excellent. Thank you. And I'm so glad that Jennifer's been able to join us. I was hoping she would be here in case during Q&A we could get some comments from her too. Do you know those 4 basic types of exercise that they talked about? So there's aerobic, everybody knows the benefits of that and they've reviewed them. Resistance or strength training, flexibility, activities, and balance. Jennifer doesn't have a program for each of those. She has multiple programs for each of those. You couldn't be at any place on the planet for us older adults better than Butterfield Trail in terms of what's offered program-wise for activity and exercise and all these health benefits that that's why we've called you here. I think I've told some of you I had become so impressed with the benefits of Tai Chi a few years before I got to Butterfield Trail. And I said, boy, I'm going to go out there and talk them into doing some Tai Chi. Well, I'd have to catch her between Tai Chi classes to recommend that to her. So she's way ahead of almost any senior campus I can imagine anywhere, and I'm so glad of that. So are there questions? Yes, Dr. Helen. Let me just go ahead and give you this microphone. You can all hear.
Well, I want to start with a comment, and that's this. All of our lectures from doctors who are rotating through here have just been really good. In my opinion, the two of you today were the best that we have ever had.
Thank you.
And there's a reason for that. You're supposed to listen to us on this one. But your material was good, it was understandable, but particularly I was impressed as an old college professor with your ability to lecture in a very understandable way. So kudos to you. It was just wonderful. May I follow this then with a question? Jennifer has told us, and you may know about this, but Jennifer has told us that after a meal, if you exercise within about an hour or 90 minutes of that meal, you will get better control of your blood sugar. Have you ever heard of that? Perhaps not, but if you had, or anyway, I was going to ask you to explain the possible physiological basis for this occurring.
So one of the things that we were talking about with exercise that I mentioned earlier that's worth reiterating because it takes a little bit to visualize even for medical students is that when you exercise, you have glucose transporters. They come out of the inside of your muscle cells, your liver cells. They go to the cell surface where your blood vessel is, where the sugar is from your meal, and they let sugar in from your bloodstream into your cells. Now, I say that because we think about insulin. At rest, after you eat a meal, or really anytime you eat a meal, at rest or not, your pancreas secretes insulin, right? All insulin does is they go attached to your cells, and that brings a glucose transporter to the cell surface to get sugar out of the bloodstream. But those are insulin-dependent glucose transporters. And so the point we made earlier and the point with any exercise is that you have non-insulin dependent glucose transporters that suck blood sugar out of the blood or sugar out of the blood into your liver cells, into your muscle cells, and your other cells of your body. Now, and there's two factors on eating a meal. The first best thing is just to not eat a bunch of sugar, right? Because you don't want to, if you eat a bunch of sugar, at some point, your cells won't respond as well to the signal of insulin. That's what diabetes is. We have these cutoffs to call it diabetes, prediabetes, but you just have a growing resistance to the signal of insulin. Insulin says, hey, cells, take up this blood sugar. But if it gets secreted too much because you eat too much sugar, then at some point it stops working. And your blood sugar stays high. And that's diabetes. And that's, do y'all know the consequences of diabetes? It's cardiovascular disease. Like I say, we talked about if your pipes don't work, if they're diseased, then the rest of your body is diseased. Coronary diabetes is an equivalent risk of a heart attack is already having a heart attack. Big deal, because it increases the plaque in your coronary arteries. You'll get changes to your retina. A lot of people lose their limbs because the blood flow to their limbs is terrible. Now, as far as exercising after a meal, again, I would want you to always think about what you're putting in your mouth first. You don't have to exercise your eating if the eating's good in the first place, right?
Well, no, the point of my question is it's remarkable to me that, and this is in the literature as well as Jennifer's a resource to you. You can exercise then after a meal within a 90-minute period for just 10 minutes, and it would control your blood sugar. And that to me is remarkable given all of the complexities of what you've just said. Thank you.
Yes, it does not, again, that's a good point. It doesn't take a lot of exercise to decrease your blood sugar, to suck up the sugar. The only thing I might tell you after a meal, though, is that when you eat, it can take up to 8 hours for that meal to be churned up in your stomach, go into your small intestines, and eventually be absorbed. So you actually absorb a meal for many hours after you eat it, unless it's very simple, like you just drank a Gatorade. That's going to be absorbed very quickly. Well, yeah, I mean, I just always want you to think about both sides of the equation, right? What we're putting in, how long it gets digested, and then what demand your cells are placing to suck that sugar out of the blood, which exercise does to a very high degree, as insulin does if you're not exercising. Right?
Just to be clear, Dr. Mann, you're not suggesting doing away with the desserts at Butterfield Trail, are you? That would be controversial. It's dessert with exercise, right? You're on your own and deciding on the other questions. Yes, ma'am.
I have a great deal of pain because I have scoliosis. Is it best to just push through the pain when I'm exercising or to rest?
So I'm with you. I've also had rods in my back for scoliosis, so yeah, it hurts. I think starting out slow and building up, you know, and I'm sure you guys have yoga and that kind of stuff. Get in with Jennifer on that. That's going to help a lot of the pain too. I wouldn't say, you don't want to push yourself to a breaking point by any means, but exercise overall is going to be beneficial for that mobility in your back.
She hedged that perfectly because that's exactly what I was going to say. Just pushing ahead blindly and making yourself gut it out could easily go too far and actually make things worse. But no activity, no exercise wouldn't be the answer either. So let's see a question back here. Who had their hand up? Now someone flashed their hand up and then thought better of it. They were talking. You're just talking with your hands? Okay. Other questions? Now, you're not this silent. I've never known you to hold back like this. Jennifer, do you have comments? No. Okay. Now, I really have never known that. So. Then I should have been thinking. I had no idea I was going to be under pressure to say anything. Well, Dr. Helen, I totally agree with you. I think they did explain it very well. To me, this isn't exactly an academic presentation. They get some credit for it academically, but the truth is, it's explaining difficult concepts in terms and with sufficient explanation to be effective with public education, with individuals. And, it's all part of a bigger notion, too, that how you as a patient, how each of us as a patient carries through with the recommendations of a physician. You're the one that's going to make your health better. It's really not a physician. I hope you have a physician that's supporting you and encouraging you in the right directions and points you, if it's not obvious to you, what kind of things make sense for your health. But the truth is, it's up to you. You can do more than a doctor can, ultimately. Yes.
Well, since we have a little time, I would like to request, if you will, explaining to us about antioxidants, why they're necessary, why they're good. You mentioned that in the fact that exercise is good for that. Why is it necessary? What are we talking about here?
That's a great question.
It is a good question.
My snack every day is a bowl full of blueberries and almonds. I got to do that guilt-free, just antioxidant. Okay.
So how many people had chemistry? Okay.
How many had chemistry?
Because that's what we're talking about. We're talking about free radicals. So if you remember in chemistry, all your electrons, all these little atoms have electrons on the outside. Now, oxidative stress occurs when, there's an oxygen radical. There's one molecule is attached to oxygen, and there's a free electron that just desperately wants to bind to another electron. This is at the atomic level. So it goes and steals those from just all over your body, cells, and just any atom, any molecule, any cell, anywhere in your body. But it can cause damage. So what your antioxidant systems, whether internally from stuff like superoxide dismutase and other enzymes, or some of the nutrients you take in, vitamin C. Vitamin E is a lipid-soluble antioxidant, which is important because what's your brain mostly made out of? Fat. So, it's nice to have, vitamin C is more water soluble, right? And so you need those things to be in those different tissues. But you do have mechanisms in your body to fight those free radicals, to fight oxidative damage. So what an antioxidant does is that it's there to pair with that unpaired electron, and it quenches that oxidative reaction. So it keeps the damage from just going on down the line in your body. Because if you have a free radical going around your body stealing electrons, it's kind of an ongoing chain of damage until that's quenched. It's been a long time since I've had chemistry, so but that really is down at the atomic level, really, and we're talking about free radicals. So all these supplements that you see, those are all attempts to increase your antioxidant capacity, right? We're trying to take vitamin C, vitamin E. Those often haven't been proven to work, but the point that has been proven as far as exercise goes is that increasing your own body's antioxidant capacity, it's been shown to work through exercise. You have those mechanisms in your body to quench those oxidative reactions by giving yourself a little bit of oxidative stress every day through exercise. And that's really going to occur with anytime your heart rate goes up, any resistance training you do, really any function of your body can produce free radicals. Okay, breaking down nutrients produces free radicals. Inhaling oxygen in your tissues, using more oxygen produces free radicals. So it's really a constant process. It's not something that you have to go buy every antioxidant off the shelf to combat. Okay, it's something your body's dealt with every moment of its life. It's just that you do increase your capacity to deal with that stress if you stress your body a little bit every day. That's kind of the macro view, and then the microscopic view is what we're talking about with an unpaired electron, essentially. Does that make any sense? Okay.
As they were talking earlier, I thought with regret that I didn't suggest a certain slide that I saw for the first time years ago about the physical changes with age that we all go through. And I want to tell you what visibly the most impressive change with age. So the slides, I used to have these 3 slides, and what they are basically like a CAT scan sliced through the thigh. So it's just, it's a circle. And the outer rim is the skin. The underneath that is the subcutaneous fat, under the skin, the fat. Then, so we're going down like this. Then there's the muscle. Okay, the biggest part of this circumference is this muscle, and then right in the middle is the bone. Then you throw it up. So that's 20 years old, and that's 50 years old. Doesn't change much. At 80 years old, you know what? The circumference often isn't that. The outer circumference isn't that different. But you know what the big difference is between the muscle and the fat? The muscle has shrunk, has atrophied. The bone is about the same. It may be thin, it may be osteoporotic, but the bone will be about the same. But between the muscle and the fat, it's impressive visibly, how much the muscle has atrophied. And this, I thought they made a really good case for how exercise, especially resistance training and aerobics, forestalls that, mitigates substantially against that. You can't reverse aging or prevent it completely, but you can. That's one aspect of that we think of as aging that can absolutely be influenced. So with that, I want to ask Jennifer a question, since she's not jumping up. And you know what makes Jennifer so great? I bet you'll agree with this. She's so passionate about what she does. She so believes in exercise and everything that makes for great health. But she believes in you. She believes there's not a person here at Butterfield Trail that can't benefit from the kind of things she's put together, and she's always looking for new things. So with that kind of experience that you have, which I think is priceless, I want to ask you, what do you see in individuals, us who come to you and say, what can you do to make me stronger? What do you see as the biggest obstacle to doing all the things that these young doctors are suggesting that we all ought to do as we age? Is it fear? I know it's not laziness.
No.
It's not laziness, but it's some kind of inhibition about it. It requires a discipline, and what keeps us from committing to that discipline?
Oh my gosh, that's what I try to look up and study all the time. I'm always trying to find that answer, because I feel like if I have that answer, I can work towards getting more people involved. So it's a great question, and one that I'm always striving for. I think it's kind of a mixture. I think it's when you first start, it doesn't feel good. So really having to be convinced of the benefit of it.
It's kind of a leap of faith to begin with, isn't
Yeah.
it? Commit until you feel better.
I think it's also because Ricky does a good job and keeps them busy with everything else. So there's other options. Just kidding.
Good point. Good point.
Yeah. And I think it's harder if you have not had a lifelong history of exercise and it's a new routine.
Harder, but not impossible, right?
Not
Never impossible,
Your
right?
body always reacts. I'm always amazed at somebody who comes in, has not been staying in shape, and the changes that I get to see. So I don't think it's ever too late to start. And I just think sometimes the hurdle might be that it's new, not done before, and needing to really see that it's going to benefit.
And obviously, we're not emphasizing it, but there obviously are physical limitations sometimes imposed by disease, everything from arthritis to heart disease and everything else. But within those limitations, an individual can find the sphere of the possible.
Yes,
Right.
yes. I mean, I've seen incredible changes because I feel like the blessing is usually on me. I get to grow and stay motivated because what I see, that keeps me motivated.
Well, people at Butterfield are pretty inspirational when they
Yes.
take something on.
Yeah.
But I'm sure I've talked to people, and part of what they're saying is, there comes Jennifer, I need to walk around this way.
Yeah, I get that.
Jennifer's the little bird that's your conscience on your shoulder, right?
Yeah, exactly.
And she does it, she's so kind about it that you can't get mad at her. Can you? I think I'm right.
Hopefully.
Any last comment? Thank you all for coming. Thoroughly enjoyed it.
Thank you for inviting me.
Thanks for
Thank
coming.
you.